Hari Om, Shri Ram, Ambadnya. Now in this video, we are going to talk how exactly the speech journey or the journey of speech development in autism spectrum disorder should begin. And before that, but to learn this, or before that, we should know that exactly what is going wrong and why the things are not taking place and the things are not falling in place. Okay, that we need to understand. So here, just in the earlier video, I discussed that visual sense, it gets dominated. It is a dominating sense and it is very dominant in the children with neurodivergence, with the children who are on spectrum. So let me ask you one question over here. Okay, suppose there are two babies born, okay, at the same time. The babies are born at the same time. One baby is born blind and the another baby born deaf, that is not able to hear since birth. So which baby will start talking as they grow in the process of development? Which baby will start talking? Yes, most of you are thinking right. That is, the baby who is blind, who is not able to see, that baby will start talking as it grows. Okay? Means what? In order to develop good speech, language, two-way verbal communication, the visual sense is not that important. Okay? Visual sense is not that important. What is most important is the sense of hearing and later on the sense of listening. That is most important. If the child who is able to hear well, the child who is able to listen well, becomes a good speaker. Who is a good listener eventually becomes a good speaker in future. So there is a close relationship between listening and speech. As I already covered, there is called as auditory feedback loop. That it starts. Okay, exactly what I listen, what I hear, that I understand and correlate. And when that relation, that understanding takes place, that hearing gets transformed into listening. Listening is the meaningful outcome of hearing. Okay, so this is what is all about. So exactly, if there are many parents, they meet me and they are already going on for some therapies they are doing. But unfortunately, in all these conventional therapies, traditional therapy methods, we see that a lot of focus is laid upon visual seeking development. Because this school of thought of conventional therapies, they think child is innately visual seeker, good visual seeker. Let us make him or her more and more visual dependent. So let us improve her via using the sense of vision more to develop him in future. But there's something I think goes wrong. In order to develop good good speech skills in the child, it is very important to develop the listening skills. And listening skills, they need to be developed via good auditory seeking skills. My child should be aware about, he should be a good listener if I want him to become a good speaker in the future. Okay, so this is where the things. Again, there is one period called as critical period for language learning. That is common to all the children. What is this critical period for language learning? The first 4 years are very important. Important in the sense, I will not say these are the only years where if your child is improving or your child can improve, not like that. But the brain's plasticity and the learnability of the child is so natural in this and fast in this age, because of which we call it as critical period for language learning. The language understanding and expressions is on its top in this period. Okay, so this is, but it doesn't mean that if your child is 5-year-old or 7-year-old or 12-year-old or 16-year-old, he is not going to grasp understanding and speech. It is not like that. First of all, we need to work on the blockages. Those are creating the barriers between the listening and speaking. Once you work on good listening skills, eventually the byproduct, that is the speech, that start flowing. And here when I say speech development, it is the spontaneous speech development, the natural outcome of the speech, and not the repetitions or echolalia that in general children develop when the speech is focused all the time. Okay, speech is focused means speech development is peak, say this, say that, this is the way. And visual seeking should be nullified in this case, as the use of flashcards, use of matching, sorting methodologies, puzzle solvings, block buildings, all those things should not be. The child should be given a natural environment, and if that is given of learning and listening fostering, definitely child will develop good speech. Hari Om, Shri Ram, Ambadnya.